the start of the pandemic, people who worked in healthcare were often referred to as heroes. We most certainly were. It's a passion of mine to help people first and foremost, but I've always enjoyed filming and making videos. And it's time that I point the camera at you, because I can't think of a group of people that deserves their story being told more than you. The staff at UNC Rockingham Health Care.
I don't even remember talking about it that much, really. And then all of a sudden, the sick people started coming in, and I think that was when we all went, oh.
But I knew, it was kind of an ominous feeling that it was coming.
I do remember when we had not only the first COVID patient in the birthing center, but just the first patient in the hospital, and the fear that created. In labor and delivery, we had several patients who came in very symptomatic. Difficulty breathing, they would have low oxygen saturations when we would hook them up. Fear was overwhelming.
It came to a point where, you were almost living on adrenaline. And that's emotionally taxing.
There were times where people got really stressed, and there were times when you were just exhausted.
We were hearing code blue at a much more frequent rate.
Once we saw what it did, it was worrisome, and I think it kind of hit home. So
I lost my uncle to COVID. I had COVID when my uncle passed away, and I told myself, I said, if I make it through this, then I would get vaccinated so I can go help myself. So a week later after that, my cousin passed away from heart failure. It was his son. And I said, I have to do it. So that's why I came back to nursing. So I work here in the ICU because I knew it was my calling to come back into nursing.
It's shocking when you go from this is happening to the world to this is happening to you.
My name is Lillian Smith, and I work in environmental services, housekeeping. When I go in, I'm always myself anyway, so I'm always smiling, and it brings a lot out of them. Some of them are really sad, but once I go in that room, I liven them up. I put the smile on their face. Some of them be wanting me to come back to see them, and
I was fearful that, not knowing after I left the patient room, would I see him in a couple of days?
when I come back to work the next day, they was passed away. It hurts me because I love the patients here.
I saw the nurses in rooms for a long time. We were spread thin, and I do remember, waiting to x-ray a patient, and I decided not to wait any longer. It had been 15 minutes. I just went in. I thought, I felt like the nurse I saw in the emergency room needed help, and so I just went in, just dove in and helped.
One of our nurses that we come to know and love and try to honor, we lost. It was a unique situation because this wasn't the beginning. It wasn't the beginning of the pandemic, so I don't think that it was expected.
It was very hard, yes. Yeah, it was difficult.
This was a person that not only have I worked with for the last 4+ years, but this was my friend. This was someone who I enjoyed spending time with, not just at work.
Taking care of our own co-workers it can be rather daunting because you know these people and you see how sick they are.
But I remember when that person was admitted to the hospital and they made the decision that they needed to intubate for care, for airway management. I just remember Heather being here that morning, and I remember her saying, "I got this."
It just kind of gets to the point where you go in, you put your head down, and you just kind of go. So
we came up for the rapid response, and I just remember her going in and dealing with that. I think she knew I was at my limit, and she stepped up.
My dad called and said, Kara, I've got COVID. And I told him all the things. You gotta keep walking. Don't get still, Dad. Take all of the medicine. On day 7, I got a phone call that he was on an ambulance on the way to the hospital because his oxygen saturations were in the low 80s. He was in the hospital for a few days and seemed to be turning around and doing well. And the last conversation that I had with him was, I'm gonna come up there as soon as I'm better. He was starting to feel better, and then I got a phone call that said, we had to intubate your dad. And he was on the ventilator about 21 days. And then on January 10th, we got a phone call that said, we don't see any quality of life if he comes through this. His nurses were like my eyes and my ears because we weren't allowed to be with him because of all the lockdown and restriction. And they would tell me, all of the lab work and his vital signs and how he was doing, and we knew what direction we were heading in. After 21 days on the ventilator, on a rotor-prone bed, after doing every measure that we had any inkling would help, we decided that he wasn't going to have any quality of life after COVID. And we let him go.
I do feel very confident because I know that our staff are very well trained to handle those emergencies.
I chose to lean into the fear and instead be confident and trust, the guidelines for doing what we needed to do. And, that's our calling as healthcare professionals. We don't run away from people that need us.
My name is Dr. Corey Vendura. I'm one of the hospitalists here at UNC Rockingham. Losing as many patients as we had through the pandemic, I think it took a toll on everybody, mentally and physically.
There's a certain degree of grief and hardship in healthcare, but this was on a completely different level that no one knew how to deal with.
Because you have to understand, there was a time during COVID where these people didn't even have family members that were allowed to visit. So, not only were they going through this, but they were going through it alone. We were their family, their support system.
I don't think anyone at this small community hospital realized how impacted we would be by COVID.
For any patient, not just COVID, I definitely don't think anybody should die alone. And so just being there, as a presence in the room, a comforting touch, just to let them know they're not by themselves. And to be able to assure that family member that, your loved one was not alone.
There were several patients that I stayed with until the end because they didn't have anybody. So that was very hard. But at the same time, you feel very fortunate to work in a small hospital that you can do that. I wouldn't want my family to be alone, and so I did what I want somebody to do for me.
It was important through the pandemic that everybody had a way to sort of take their mind off of what actually was going on in the world.
I guess I've always kind of used writing as an outlet throughout my life.
I just really started studying videography, more specifically cinematography.
The best way that I found to cope was with family and, friends, and whether that was in person when you could or on FaceTime or even just a phone call.
It's like I wanted to do something that not only would help me, but maybe give encouragement to the other staff as well. I ended up writing 2 different poems, and I just made copies of them and put them on the different units, and I didn't put my name on it or anything. I just did it kind of anonymously, just so that other people would know there's somebody out there maybe that feels the same way that they do.
All across the board, we experienced first with this virus, but the transformation that I've seen everyone make by the time we've gotten to this point, it's just outstanding.
We made a lot of progress with some of the treatments for COVID.
So the monoclonal antibodies got approved by the FDA under emergency use authorization, and I feel like that was a huge step.
I feel fully confident that we can handle whatever's thrown in our direction, and as far as healthcare goes.
We all had a bit more in us than we knew.
Being a part of, a bigger hospital system definitely had its advantages throughout the pandemic. All we had to do was pick up a phone and everybody was very receptive.
We helped individual patients get better, but then that helped the community too, as we could decrease transmission between the virus and the monoclonal antibodies. That helped our community get better, helped us have less patients in the hospital.
It was definitely an experience that we will always have.
I truly believe we've learned and grown in ways that were impossible without this pandemic.
In the end, what sustains us and what we will remember about having survived this madness are the remarkable people who endured this with us, the best of humanity, all of us, who demonstrated the best of our calling. We endured this together and supported each other. We saved lives and we lost lives. We will never forget.
While COVID-19 wounded us mentally and physically, it didn't break us. Because we truly are one great team, we will recover and we will continue to answer the call to serve others. This pandemic has been very dark, but I will always remember how you held the line when we didn't have the answers. I will always remember your bravery. From my first COVID discharge to our first COVID vaccine. I'm proud to be a part of the team that you make so great. This was your story.